Bismillah ar-Rahman ar-Rahim. Dear medical student, this is a lecture for bony pelvis. Bony pelvis is formed of two hip bones, sacrum and coccyx. Function of the bony pelvis. The bony pelvis protects the pelvic viscera. Pelvic viscera as urinary bladder, uterus in female, rectum male and female. Second function, to support the weight of the body, transfer the weight of the body of the upper body from the axial to the lower appendicular skeleton. يبقى transfer الweight from the upper part of the body to the lower limb. Provide attachment for the muscles of the lower limb and the muscles of the trunk. In female, the bony pelvis support the birth canal. This is a function of the bony pelvis. This is a short essay question. What is the function of the bony pelvis? The bony pelvis formed of two hip bones, sacrum and the coccyx. The details of the hip bones, sacrum and the coccyx not needed in this lecture. This is the hip bone. We just make revision for parts of the hip bone. The hip bone formed of three parts: ilium in yellow color, pubic bone in red color, and ischium in blue color. Also, remember sacrum, it formed of the body of the sacrum, promontory of the sacrum, ala of the sacrum. Sacrum is triangular in shape, and this is the anterior surface of the sacrum, and this is the posterior surface of the sacrum. Bismillah ar-Rahman ar-Rahim. Classification of the pelvis. From this diagram, the pelvis is divided into two parts: the upper part, which is called the false pelvis, the lower part, which is called true pelvis. This is the upper part of the pelvis, is called the false pelvis because it is related to the abdominal cavity. This is the iliac fossa in the hip bone, which is a part of the abdominal cavity. But the lower part of the pelvis is called the true pelvis. This is a true pelvis. The true pelvis have pelvic inlet from upward and the pelvic outlet. This is a pelvic inlet and this is a pelvic outlet. This is a pelvic inlet. The pelvic inlet boundaries from the symphysis pubis, pubic crest, pubic tubercle, pectineal line, and promontory of the sacrum and the ala of the sacrum. This is the pelvic inlet. Measurement of the pelvic inlet, or measurement of the diameter of the pelvic inlet: 3 anterior posterior diameter. The first one, or the upper one, from the promontory of the sacrum to the upper surface of the symphysis pubis is called a true conjugate diameter. The lower one from the lower border of the symphysis pubis to the perimeter of the sacrum is called diagonal conjugate diameter. The middle one from the perimeter of the sacrum to the middle of the symphysis pubis obstetric conjugate diameter. This is anteroposterior diameter. Only one transverse diameter. This diagram of this table summarize the diameters and is very important for the medical student. Anteroposterior diameter, true conjugate, measurement 11.5 centimeter, diagonal conjugate lower one 12 centimeter, obstetric conjugate middle one 10.5 centimeter, transverse diameter which is the widest diameter 13.5 centimeter. Again, this is the anteroposterior diameter. We can determine the diagonal conjugate lower one, lower diameter from vaginal examination. This is a vaginal examination. This is a symphysis pubis, and this is perimeter of the sacrum. By vaginal examination, we can feel the lower border of the symphysis pubis and the tip of the finger reach to the perimeter of the sacrum, and this is diagonal conjugate. But actually, we must determine the obstetric conjugate. The obstetric conjugate diameter equal, we must subtract 1.5 up to 2 centimeter from the diagonal conjugate. Now, this is a pelvic outlet. The pelvic outlet from the symphysis pubis, this is called the pubic arch. Lower part from the pubic bone and part from ischial bone, and this ligament from the ischial tuberosity to the sacrum called the sacrotuberous ligament, and the tip of the coccyx. This is pelvic outlet. Diameters of the pelvic outlet, two diameter, anteroposterior diameter and transverse diameter. This table showing a diameter of the pelvic outlet, anteroposterior diameter 12.5 centimeter, transverse diameter 11 centimeter. In male and female pelvis, there are two types actually, male pelvis and female pelvis. The medical student must know the difference between male and female pelvis. This table summarizes the difference between male and female pelvis. This is the female pelvis and this is the male pelvis. The bone of the female pelvis lighter and thinner. Bones in the male pelvis heavier and thicker. False pelvis is shallow in female. False pelvis lower upper part. False pelvis is deeper in male. Pelvic cavity of the true pelvis is wide and shallow. Pelvic cavity is narrow and deep. This point is very important. Why? During delivery, the baby to pass easily from the Percy canal in the female, it must be the cavity, wide cavity and a shallow cavity. So the characters of the female pelvis, or typical characters of the female pelvis, it must be wide and shallow. Pelvic outlet also must be large in female pelvis, but a pelvic outlet small in the male pelvis. Subpubic angle. What's the subpubic angle? See, this is the subpubic angle. Here, it wide in female pelvis and it narrow in the male pelvis. يبقى subpubic angle large in female pelvis والsubpubic angle more acute in or more small in the male pelvis. الcoccyx flexible and straight. This is the coccyx, flexible and straight, but the coccyx in male less flexible and curved forward. Ischial tuberosity more everted in female pelvis. This is ischial tuberosity everted out, but ischial tuberosity in male inverted in the male. This table is very important, may be asked in short essay question. Mention 4 difference between male and female pelvis. This slide is very important. Difference between male and female pelvis, but the previous table is most important. Variation of the pelvic shape. Female pelvis, normal variation, 4 types. Normal variation, gynecoid pelvis in female is atypical in all characters. Android like male pelvis. Platypilloid or flat pelvis. Platypilloid or flat pelvis, short anteroposterior diameter and wide transverse diameter. Anthropoid, long anteroposterior diameter and short transverse diameter, anthropoid. This is normal variation. May be asked, normal variation of the female pelvis. Gynecoid, android, platypilloid, anthropoid. Abnormal variation of the female pelvis, symmetrical contracted pelvis. All diameters are contracted, but symmetrical. Rachitic pelvis in rickets. Rickets is a disease due to vitamin D deficiency, so there are some deformity of the pelvis. Asymmetrical pelvis, both sides not the same, asymmetrical. This is the details of different types of pelvis. Gynecoid pelvis, android pelvis. This is the characters of the android pelvis. Anthropoid pelvis, platypilloid pelvis. Pelvic wall. This is the anterior wall of the pelvis, posterior of the pelvis, and the lateral wall of the pelvis. Pelvic floor is very, very important for medical students. Pelvic floor. This is the pelvic floor. The pelvic floor which separate pelvic cavity from the perineum. There are a small cavity below this floor called this pelvic floor or pelvic diaphragm, sometimes called the pelvic diaphragm, called the perineum. Pelvic floor is formed of muscles called the levator ani muscle, and another muscle called the coccygeus. Pelvic floor formed of 2 muscles, levator ani muscle, this is a levator ani muscle, and a small muscle called the coccygeus. Levator ani muscle, or sometimes the 2 muscles called pelvic diaphragm, this is the origin of the levator ani from both sides and inserted in the midline. Linear origin, this is the linear origin of the levator ani. It takes origin from the body of the pubic bone. It takes origin from this area called white line. What is the white line? Muscle here called obturator internus covered by fascia called obturator fascia, and from the obturator fascia the muscle fibers arise here. This is the muscle fibers take origin from this line, and also fibers take origin from the ischial spine. The muscle meeting each other in the midline, leaving 2 openings, this opening anterior and this opening posterior. The levator ani divided into three parts: anterior part, intermediate part, and the posterior part. The anterior part of the levator ani, this is the anterior part of the levator ani, which surrounds this opening. This opening in male, the prostate present here, so these fibers of the levator ani called levator prostate. These fibers are anterior fibers. But in the female, the vagina passes from this opening, so this fiber is called the sphincter vaginae. The medial part surround, or intermediate part surrounds this opening. This opening, the rectum passes from this opening and they continue as anal canal. So the intermediate fibers called puborectalis and pubococcygeus. Why? Because these fibers surround the beginning of the anal canal and the termination of the rectum. The posterior fiber called iliococcygeus. This is the three parts of the levator ani. Again, the anterior part here, intermediate part here, and the posterior part here. Nerve supply of the levator ani. The levator ani take nerve supply from the upper surface and the lower surface. Have double nerve supply. From the upper surface, it takes nerve supply from the fourth sacral nerve. From the lower surface, it takes nerve supply from the peroneal branch of the pudendal nerve. Action of the levator ani. The levator ani support the pelvic viscera. Also sling-like action or sphincter-like action because it's surrounding the termination of the rectum and the beginning of anal canal. It acts as a sphincter of the anal canal. Additionally, when the abdominal wall muscles contract and the pelvic floor muscle contract, the whole pelvic diaphragm, it is very important in what's called expulsive action. Expulsive action during the coughing, during defecation, during micturition, and so on, and during labor. It is called expulsive action. Right. From this lecture, we can summarize the bony pelvis. We want diameter of the pelvic inlet, diameter of the pelvic outlet, very important. Also, very important, difference between male and the female pelvis, especially in short S question. And finally, lower pelvic floor or levator ani muscle, very, very important. Very, very important for medical student. Blood vessels or blood supply of the bony pelvis. Abdominal aorta divided into two common iliac. This is the common iliac, which divided into external iliac and the internal iliac. This is the external iliac and this is the internal iliac. This is the abdominal aorta, common iliac, internal iliac. This is abdominal aorta divided into common iliac, internal iliac, external iliac. The internal iliac again divided into anterior division and the posterior division. This is the anterior division and this is the posterior division. Branches of the internal iliac branch from the posterior division, three branches: iliolumbar, lateral sacral, and supragluteal. We need also enumerate branches: iliolumbar, lateral sacral, supragluteal. This is the iliolumbar details, lateral sacral, and supragluteal. We need only enumerate. Branches from the anterior division. The anterior division divided into what's called parietal branches, wall, pelvic wall, and the visceral branches to the pelvic viscera. Also, we need Names: the parietal branches of thyroid artery, internal pudendal artery, inferior gluteal artery. Visceral branches: umbilical artery. The umbilical artery gives very important branch supravesical. So after pairs, the umbilical artery visceral branches, umbilical artery, which gives very important branch with the supravesical. After pairs, the umbilical artery obliterate. Not all the umbilical artery obliterate. Obliteration occurs after it gives the superior vesical branch. After it gives the superior vesical branch. Second branch, middle rectal. Branch number 1 and branch number 2 present in male and female. Branch number 3 in male, inferior vesical in male, but in female it replaced by vaginal artery. Remember, there is no inferior vesical artery in female. Inferior vesical artery in male only. Uterine artery present only in female. You must know branches, parietal branches and visceral branches, just names. And also, you must know these are the first branch, umbilical artery and supravesical. Obliteration of the umbilical artery after it gives the superior vesicle. This is the details. Uterine artery especially, you must know some details about the uterine artery. This is the uterine artery. This is diagrams for branches. This is very important branch, which is the uterine artery. This is the uterine artery. This is the uterine artery. From the lateral of the pelvis, it crosses the pelvis to reach the uterus. The uterine artery crosses in front of the ureter. This is the ureter. This is the urinary bladder. This is the uterus cut here. We cut the uterus. This part. This is the uterine artery, and this is the ureter. The uterine artery crosses the ureter during what is called hysterectomy. What is the hysterectomy? Removal of the uterus, as in case of cancer. The surgeon ligate the uterine artery, but it's very important during the ligation of the uterine artery, don't ligate the ureter. If the surgeon ligates the ureter, it will lead to renal failure. So you must remember uterine artery crossing the ureter near the cervix, as seen in the diagram. Now, this is the uterine artery, ureter from up down. This is the blood supply of the vagina. Also, in median sacral artery supplies the pelvis. The median sacral artery arises from the back of the abdominal aorta. This is some details of the median sacral artery, and this is a branch of the median sacral artery. This pair of the lumbar arteries to the back of the sacrum, and so on. The medical student must know the median sacral artery arises from the back of the abdominal aorta in front of fourth and fifth lumbar vertebrae. Thank you for all.